Not everybody knows what the prostate is. It's a small gland about the size of a walnut or a 50-cent piece that only men have. So women, you don't have to worry about this personally, but men have a prostate and it's tucked up under their bladder. We love to catch prostate cancer before there are any signs or symptoms. And in order to do that, you need a blood test called a PSA. But if your prostate cancer grows enough to where it's causing symptoms, it can cause blood in the urine and blood in the semen. It can cause difficulty urinating. Some people can't urinate at all and need a catheter. And if it's really advanced, people have bone pain, weight loss, and swollen lymph nodes. There is a difference between the colon and colon cancer screening and prostate screening. And a lot of people, especially men, who need to have one also need to have the other. So there are a lot of men age 50 to 65 who should have both colon cancer screening and prostate cancer screening, but they're not the same thing. The prostate is part of the urinary tract, it's under the bladder, and the colon is part of the GI tract. So a colonoscopy is where doctors place a telescope in your colon to check for colon cancer or polyps, and they're not necessarily checking for prostate cancer during that. Many of the people that we take care of in Eastern North Carolina are high risk for prostate cancer. So especially anybody who is African American or Hispanic between the ages of 45 and 65. Those folks all need a PSA checked every year. In addition, I would add any other men with a family history of prostate cancer. They should be checked every year. And men that are older than 65 should be checked if they're healthy, meaning they're on maybe 1 or 2 medications and they're overall very healthy. They should be checked once a year. With the recent COVID epidemic, a lot of people have postponed their cancer screening. And we're concerned about that because I think a lot of people are going to come in with advanced cancer 5 or 10 years from now because of COVID. They skipped their screening. So I'm here to tell you, you need to go ahead and get your screening, whether it is PSA screening, lung cancer, breast cancer, cervical cancer, or colon cancer. It's really important to get it screened so that we can cure your cancer at an early stage rather than catching it later when it's much more deadly.